Hello again. I promised you that I would bring you some more work about energy work and the body. So that's what I'm going to do for you today. I'm going to go through the body and talk about what I'm feeling and the energy work. I want you to understand that when I'm dealing with this more subtle type of modality and following the body, that it's a different way of, it's hard to show you and it's hard to explain. So you're going to have to bear with me on a lot of that. Fortunately, today we have Angie here on the table, and I haven't worked her for a very long time, so we're going to find what's going on with her body at a lot of different levels, and I'll be able to work through that, and hopefully you'll get a lot of understanding, and you can practice, or you can look for somebody that can maybe help you with this kind of stuff.
Before I came here today, I was working around the house and I paid attention to anything in my body, and I felt tension in my shoulders and in my right knee. And when Athena first pulled up my legs, she said tension in the shoulders, and she started there and then a little in the hips. So I like sometimes to test if you know what someone's getting and if it matches what I had felt. And so that was the start of that connection for me. Yes, indeed, I was tight.
The first thing I'm going to be doing is I'm looking at her and seeing the alignment of her body, which is pretty good. Angie spends a lot of time working on her inner self and on things and seeking after the knowledge and understanding we need. So her body is reflecting that. She's got a very nice straight body, but I do see a lot of tension coming in through the shoulders and down into the hips and a little bit in the legs as well. That I can feel there's tension in those legs, so we're going to soften all that up. Check the kneecaps and okay. Now Angie doesn't have any knee problems or anything with that, so I'm going to be able to lift these legs up. Once again, the heels are in the palms of my hand, and I'm just going to lift them up. Now you can tell how open their back is. Here's where it starts getting a little tight, but it's not bad. And then you want to just allow these legs to see how they want to move on their own. What you're going to pick up, and this is where it works, you have to begin to be very intuitive in your work, getting out of your head and staying into the body and the information coming from her. There was a little bit of a jump over on the right leg, her right leg, and there is some tension in that right hip. Now the tension and stuff that I'm feeling is very, very deep, that a lot of times people aren't even aware of it because it's down into the subtle structures. So I have that, and that's a little bit of a quote diagnostic that is done just to get a feel for where we started. Then I can tell at the end of how much change has happened. All right, so I'm going to start out today with just working on her feet, just to get going on the feet, and that way she can also begin to relax a little bit more. So I'm holding her heel in the palm of my hand, and it just kind of is a nice fit, just working that way. And I'm going to grab around the foot, with my hand, and hold it and give a little bit of traction, just a tiny, tiny bit of traction. But my grasp is very light. It's probably got about 10 grams, which is the weight of 2 nickels, maybe just a tad more than that. And now when I have it that light, I wait, and I'm feeling now there's a movement beginning to happen, and there's little tiny motion that's happening in the feet, in this foot. The toes are moving, and you may be able to see my hand move to a degree, but it's such small movement, and yet it's very significant. Oftentimes people will say, I don't feel that you're doing anything, but I feel really different at the end. It's because the subtle movements are so small that unless you're tuned in a lot, you won't feel it. But because it's subtle and it's internal and deep, it's very profound in the results that it gets. Now the toes, we had a little bit of movement in the foot itself, so I'm going to move up into each toe and give that a chance. So I'm just going to grab the big toe with the thumb underneath, 2 fingers across there. This is a way I can transfer energy between my fingers as well, and pull a little bit of traction on the toe. I'm not yanking it. I'm not trying to pull it out of joint. I'm not trying to crack it. I'm trying to wait to see the movement, or I am waiting, I should say, to see here it goes. And it's starting to move very slightly, very slowly. And it feels like it's turning like a jar cap. These are all of the little tiny tissues that are wound up in there, and they're taking a correction. And at the same time, I'm giving a little traction on her leg through the heel by pulling it toward me. And I'm not really pulling, that's too strong of a word. I'm just tugging, I don't know even a word for it, influencing it to a little bit of a decompression. I'm giving that small, very subtle traction to the leg as well as the toe. Everything that offers expansion, so everything can expand, the joints can expand, and then they can also begin to rotate deeper into that joint, so the joint is actually going to get a little more range of motion. And then we're going to move to the next one. After it feels like you get some movement in there and it feels a little bit more fluid than when it started, then you can move to the next toe, same thing, thumb under, fingers across, grab a little traction, which is pulling away, opening up those little tiny toe joints, continuing to pull a little bit of the traction of the leg. And by pull, it's a nudge pull. We'll call it the nudge pull because there's not enough words for some of this stuff that's subtle. And just let this all go. And this toe is happy. It's starting to move and it feels like it's open. And you will also feel things going on in the heel as well, because there's the bones that are all attaching to one another. And so as the bones are aligning in the toes, it's going to take the heel into a little bit different position as well. Also through those, the cuboid and all the other little tiny, tiny bones we have in our feet and ankles. And I moved on to the next toe, and you'll find that each one moves a little quicker because it just does. It just seems to be open, and there might be another thing that it feels like it knows what's coming and it's ready for it, so it tends to move a little quicker. And I find that when I work on the body with even lymph work, the last leg that I do is always more open than the first leg because the flow is already there, so it gets easier. And now to the little pinky, the same little grab, and just pulling it out. And that nice traction. Okay, so that has been moved, and I felt a lot of different change coming through the foot and through the ankle. I'm just going to set it down, cross my hand over the top here, and take my fingers along the toes. And now I'm holding very lightly, but I'm holding firmly, but lightly. And I'm just going to take the toes. I have to kind of position. I have basically it underneath, but when they have longer toes, you might have to use 2 fingers. And then I'm going to slowly pull traction this way on the foot and upward as I move with the toes to flex them. This would be as if she was standing on her tippy toe and going very, very slowly, feeling it deep inside. So the thing you want to start to focus on is, as a therapist, is you're going to need to get out of your head and get into totally the communication that the body is giving you. If you're in your head, you're going to try to figure things out, and you're actually slipping into more of an energy state or a vibration of more of an ego, because you're trying to figure out what she needs rather than letting her tell me what she needs. It's a very different platform to work on, and it does take time to develop that because the head loves to get in the way. So I'm just slowly bending the toes until they tell me that they don't want to bend. I'm not forcing very far, and I'm feeling little toe movements happening on the way. And I'm still pulling the traction. And big toe is, so there's a lot of little movement going on in there.
When she went into my feet, I was able to feel, I love how it's such a light touch, but it is connecting with my body. And so I felt that in my feet, and I felt my feet loving to be touched.
I kind of personify things. I always see these little cells and tissues with little frowning faces or smiley faces, because that's the way I can keep myself into her body communication rather than getting into my head, trying to figure out what's happening or if I'm doing it or da-da-da. And so there we go. And then I'm going to do just the same thing. My hand is going to be here on the ball of the foot with the finger. The fingers are along the ball of the foot there, and the other hand is on top. And now we're going to pull that traction. Even though we're pulling the traction from the ball of the foot as well as the toes, and just bringing them down a little bit and letting them bend very slowly. Now when you go slow like this and you allow the body to do what it needs to do, kind of undulate or move in little circles, semicircles, sometimes it's little jumping feelings. When you're doing that, it's making a correction, and when it goes slow like this, it gives the brain enough time to say, oh, it's okay for me to change this position, because there's a muscle memory pattern that we get into, and it's hard to get out of that patterning. And when we can get out of that patterning, then we can also make a new neural net pathway to put a new muscle memory pattern into it. And that's why correction will hold much better than the more aggressive therapies that are done. There's time and a place for everything, all different kinds of therapies, but it's important for you to understand the different therapies and work them together for what's best for you. And now I'm going to just remove that hand, and we've got pretty much the whole thing. And now when I move the foot around just to test it, it's much more fluid. It has a very good feeling to it. And then the same thing would be repeated on this foot. You just have to change your hand, so the hand is going to be a different, and then this hand is going to go across to start with. And you're going to feel the movement going on with the traction of the leg through the heel, and the traction of the foot coming toward the toes, opening up the spaces and feeling that. I'm going to go to where I feel a bunch of movement happening. Usually you want to go, and it'll actually tell you when it's time to come off, because it just feels very fluid and nice. So I'm going to go with that. As soon as I feel that first little thing, I'm going to move instead of following it longer. It will follow itself. It'll find itself. It takes about 12 to 48 hours for tissue reorganization to occur. And then we're going to move up and do each toe. And change it like so. Sometimes I just have to do it opposite because my hands work better in certain positions. That's one thing about the therapy job, the person doing the therapy, is oftentimes one hand will be more trained to feel things a certain way and the other hand does something else. When you go to the other side of the body, it's kind of backwards, a different positioning for your body. As far as the therapist body goes, you want to just remember that up and back thing and keep everything nice and long and relaxed in the shoulders, because if you have tension in your shoulders or neck or whatever, you're going to transfer that into the person's body as well, because you'll be tense and you won't be able to be as pliable as well to move with the body of the person on the table. And so I'm just moving down these toes, and they're moving very nicely. They're very ready for it.
It was interesting because it was such a light touch on the left foot that I could feel an old injury in there, a plantar fasciitis. I don't know if that's an injury, but it's an area, and she was just barely moving it. So my body just responds to this touch. And I was trying very hard not to fall asleep during my feet because I love to hear what she says, and it helps me to connect with my body.
Don't force it, just take it to where it's comfortable. It'll stop you, because if you push in further than where it wants to go, what you're going to do is you're going to create a little tension in their body. They're not going to be able to relax those muscles out in the proper way. And the whole point of this is to get the muscle memory into a relaxed body state where you're really much more relaxed. And then we do the same thing with the toes going the other direction, putting the hands across there, fingers, and then holding them and moving the toes downward and pulling that traction. So you can see that on different feet I'm in a little bit different position because it just works that way. And you can see some of the movement happening there with those toes. And I can feel some movement also in the heel again. So there's quite a bit of alignment going on in her foot. Okay. So then checking it, and it's very nice and fluid, very relaxed. There's not any resistance at all from her body, from Angie's body. It's just allowing. Okay. And both feet, even though they were feeling pretty good to start with, and most people that aren't trained in subtle work would find that there's probably not much of a problem, when you get into understanding the subtle work a little bit more.
And then when she got, let's see, I'm having to remember after I was quite tired, or not tired, but just relaxed, deeply relaxed. I know on the right knee she said, oh, I felt a lot of movement. And that's an area, yesterday I was having a little bit of sharpness in that area. And so that area seemed to need a lot of realignment.
The first thing I usually do is put one hand above and one hand below where the joint comes together, the muscles in the joint itself. The kneecap is of course right there, because I want to feel for the alignment of the knee also with these two lower leg bones. So my thumb is going to come across that, and you'll be able to see that, how that is. So I'm just going to hold it again and pull my energy and a little bit of the subtle work into the body until I feel like I'm connecting magnetically, or maybe it's a little more like Velcro. And then to get into the energy work of it, the secret of that is you back out at the physical level while you push the energy in at the energetic level. And this takes a long time to practice, mainly because you have to get your head out of the way. That ego body wants to get in there and be such a hot shot, but you really will be much more effective if you get it out of the way and just honor the communication that you're getting from the body through your hands. I'm feeling a lot in the adductor muscle that's attaching into the knee area, and there is some of the joint movement happening, so the joint is a little bit, it's never bad because we don't feel pain, but it is a little bit out of alignment, and that is going to cause a little bit of wear and tear, which we don't want to do. And of course, we have to couple this with good nutrition, and we have to be able to make sure that our body can signal with the signaling molecules, that they can signal each other and be able to repair and replace the tissues so that we don't come upon pain or dysfunction. So this is very interesting because there's a lot of rumbling going on under my fingers and even into some of the palm of my hand and my thumb. So there's a lot of little stuff happening. Okay, so then I'm going to let go of a little more of the physical and push a little more energy in. And that's a whole different feeling when you start to do that. It's a whole different feeling. Okay, check. And then to check the range of motion with this is I usually sit down And again, if they don't have knee problems, you can get away with a little bit more than knee problems, but I still like to support the knee. So this other hand is going to be underneath, not the knee itself exactly, just a little bit above the knee. The back of the knee is a very vulnerable place, so you don't ever want to put a lot of pressure there. Sometimes if you're using a bolster and it's right there on behind the knee, it's going to cause their feet to go to sleep. So always have the bolster just a little bit higher than the knees so that they have good blood flow and the nerves aren't going to go to sleep or anything. So here I'm going to be picking up her leg, and I want you to just stay real relaxed. But you know, if you feel the person helping you, that means it's unconscious stress. So I'm going to put that there, place it, and then place her foot down. Kind of move in so it's held a little bit with my body. And then I'm going to move it here and just take some traction in both directions upward. Mostly pulling from that direction, but also pulling a little bit up from the lower part. However, the lower part kind of goes up and it makes a little curve around, so you're kind of pulling it up into the joint and then you're kind of rotating it. That's the way it always feels like it wants to go. So it's up and a little bit of a rotation. And then I'm just going to feel how the knee is moving here. So now I'm going to the hip. If you're going to be doing this work, you want to work like the whole leg, the foot, knee, and hip, and foot, knee, and hip. So that's kind of the sequence that you want to do. But for demonstration and all that, it's going to be broken apart a little bit differently. So just understand that this is just all part of getting it to you in a proper way. So I'm going to be moving to the hip, and I'm going to lift. First of all, I'm going to check the rotation by just holding up onto this thigh and rolling it to see how far it wants to rotate, and then pulling it the other way. And again, it's not really pulling or pushing, it's nudging it one way or the other, because that you're going to focus in on feeling how tight things are, and you can do the same thing up closer into the joint. You can see if there's any kind of restrictions. There's a lot of different work to do for the hip, so I'm just showing you really the stuff when people don't have really any problems with their hips, that they're just more tension, just normal tension rather than an injury. Now I'm going to hold her leg up like this, and the best way for me to do this is to get onto the table and then bring her leg up and rest it on my shoulder. And then I'm going to scoot to where I'm close in and just hold there, and I'm holding the knee area, focusing a lot more on the joint stuff right now. So you can check that rotation with the leg up as well. And then I usually like to put my fingers right into the hip flexor area where it's right bent in this little crook, because that's where the muscle is going to be the most tense. So I just hold my fingers there and I wait for it to sink in, and she's going to pull me in with that. Now we're going to start. Now she's starting to move. The hip is going to give us more motion because it's a bigger joint, and I'm following her. I'm not leading her at all. She's leading where I need to go, and she's coming forward. So this is where the body mechanics of the therapist is going to make a lot of difference. So I'm leaning forward with her, with my body, and now she's going to open to the side a little bit. I can always tell, after you get good at this, you can tell the direction. Now she's stopping right here. So there's some tension right here that she's waiting to work out. I'm just going to wait with it. And there's a little movement down in my fingertips. A pulsing, when you feel a pulsing. That's, we consider that in cranial work although this is cranial work, but we consider that pulse a therapeutic pulse, which means that it just went. The tissues are getting ready to move. It's like they're being shaken up and they don't exactly know what to do, and then they reorganize themselves. Now she's coming a little bit more open here. And I'm going to move with all my fingers in there on one hand and help to hold here. because she's going into a very different position. Now, when you move your body as a therapist, you're going to want to move it so you don't be jerking the leg around. And this is where it's important to stay somewhat flexible, and you do need to be fairly strong because this work can be pretty heavy. Fortunately, Angie is not one of the heavy people, so I don't have to grunt and groan as much. But her leg is coming and this whole joint is opening. And we're stopping right there. Okay, she's starting to want to take a twist, so I'm holding with my chin across her to hold that leg there. And it's going to rotate because it wants to rotate. It's really tight. It's a little rotation, so I have to move my body in, and it's not easy to do. There we go. It's rotating and there's a lot of movement under there. The muscle is okay. It just let go. Now this is a position, these are the things you do a lot when they have hip problems. So if you're going to work on hips with the subtle anatomy, you might as well get used to being a contortionist, because you almost have to be in that space of being able to move your body well. Okay, and then I do like to hold with my chin. It seems to steady the leg, and sometimes it feels like it's going to fall off. Sometimes there's bone on bone. You might want to put a little cloth there, a little hand towel or something. Now her leg is just taking me where it wants to go, so I have to follow it and move my body with it, keeping my body in alignment as well. And there we go. There's a stop point. The muscle is in an entirely different position. So I'm going to hold and wait, kind of re-angling. Now she's moving me around on her hip, so that hand is beginning to move. And she's rotating in this. Now she's coming back. Whoa. And she's wanting to come down. But she's coming down in a pattern of unwinding. And here I'm going to let it up, grab that leg and everything, and then drop it down. And there we have it. So now I'm going to just check and see that the rotation of the hip going deep in there, and it's moving with a lot more fluidity. Now I want to mention something else here about the hip, or anything, any place, but particularly when you get in these deep structures like the hips, is that Angie was saying that she felt certain things going on, very interesting sensations. Nothing was painful, but just interesting things. Oftentimes that's a place where there will be an emotion hidden when you start getting that kind of a sensation. And if I'm working with somebody with emotional work, then when that stop point is, oftentimes I will ask if there's anything there, if there's an emotion attached there. People will go into a deep state. It's not really a hypnotic state or anything, because you're still really here, but you're just going deeper into your body. And by the way, what I'm doing here is I'm just unwinding it with a flat leg, with a long leg. So when that emotion comes up, then I will follow that emotional thing. And oftentimes when that is showing itself and the emotion is identified, the structure changes in a very profound way, very profound. You feel it, everybody feels it, and it's like a big breath I take, as well as the person on the table will take, the person I'm working on.
There was an area once, so when she sat on the hip, she goes, "Ooh, there's a tight spot right in that hip," and she said that sometimes she would stop and ask for the emotion there. And I do believe there was an emotion in that left hip when it was moving, and I had never felt a tightness in that area before. It was just like a little rope. So I may go back and explore that emotion that I do think is in there.
So this other leg we're bringing up, and that and be sure that they don't help you, and if they do help you, sometimes they can't not help you because the tension is so in the muscle that they think they're relaxed, but they're really not, but you'll be able to tell that. So I'm going to pull this in a little bit and feel the rotation, and then you have to always follow what the body's doing, and sometimes you don't always know what you're going to be doing, but I do have to get her onto my shoulder. So I'm getting that onto the shoulder, and now I'm able to lift that up much better. Here we go, it's coming up now, slowly. And it usually needs to come at about a 90 degree. There's not really a step 1, step 2, step 3 in any of this work. It's much more intuitive, and it's important that you get your head out of the way so you can listen. Now I'm going to go back and hold this on the shoulder. Now she's not as high, so I'm going to have to lean back a little bit, and we're going to take this up. But the thing is you'll also want to listen very closely, because sometimes the body will just call you to another place, and I guarantee you, if you put your head in the way of that, it's going to really mess you up. You just got to do it and just trust that you're going to the right place, and ask for validation. When I was learning this and practicing it more and more, I would say, put your hand on something, and I would think, well, that's not even related where I'm working. I would say that in my head, and then I would catch myself, and the next thing I know, the person on the table would say, how did you know that's where I hurt? So it's good to tune into that intuitive part. And I'm going to talk at some point more about what's important to be able to get there, because there's not even kind of, there are people out there that think they're operating on their intuitive sense, but they're really operating on their program. And it's usually a program that doesn't have a lot of understanding behind it. And it's still quite an ego state. So be mindful of that if you want to be a good therapist. Now this hip feels completely different than the other one. And it's pulsing right now. And it's wanting to pull a little more forward, but it's starting to direct me into the opening of it. A little bit more. It's very okay there. It seemed to really let go. Felt like there was a very tight spot, and now it's rotating. So I'm gonna move my hand here and rotate and keep that steady. And okay, this hip is doing some weird things. And again, you're going to learn a lot about how you got to be strong. So do a lot of those V-sits that I've showed you, because you're going to need them. And, okay. There, she's stopping. So I'm going to go back here just to give some energy in there. And then, there we go. There we go. Okay, there we opened it. You feel that? And I'm going to take this like so now. This hip behaved completely different than the other one. It's wanting to rotate the other direction. It's moving. When it moves smooth and fast, that shows that there's not any restriction. And Angie has got it all worked out. It's coming down in an odd pattern. It doesn't want to go straight down. Oh, there was a big relax at the end there. There was a little bit of a holding coming down, and it released. As it met a certain point, the muscle said, I trust it, I'm going to go. And then, yeah. And that has got a better rotation, and the muscles are a lot softer at a deeper level. So now that we've done both hips, the thing that we want to check to make sure for the alignment patterning is to check the sacrum, because the hips might have moved a little bit, and the ilium and all that is probably a little bit different, even though it's not very noticeable. And I can see now in the structure, the way the leg came down, that there is a little bit of change in the sacrum, because the legs are not as symmetrical as when we started, but they're actually going to be more symmetrical. It's because the pattern changed in the hips, and now we want to make sure that the alignment is with the sacrum. So you do the normal getting into the sacral pull type thing, where your hand is coming out from underneath, and then you're rolling the body a little forward and sliding your hand underneath them. That's something you can ask their people to lift up a little bit. But that's where you're cupping the sacrum right in your hand, and you're waiting now. You're going to wait for the sacrum to sink into your hand, because there's always a little tension when you first go there, because you've moved the body and rattled it up a little bit. And so now we're just going to wait, and I'll tell you what I'm feeling once I get there. And there has been a little bit of a shift to throw that leg up. The sacrum is in a little bit of a side bend position, and it's already starting to work. It's already starting to take this little twist. It's moving in this kind of a pattern, like a circular. It's kind of like if this was a sacrum in my hand. It's moving like this, and so there to there. It's kind of going like that. It's hard to explain. And then the other place you can place your hand right across the abdomen, because there's a band that runs across that we call a diaphragm. It's the pelvic diaphragm, and you want to make sure that that is well relaxed. And that's just a little ways above the pubic bone and between the hip crests. So you can just hold there. And now when the sacrum feels like it sinks into your hand, you want to give a little, it's a stretch on the sacrum where if you can see my hand kind of just opening, that's the kind of stretch that you want to feel with it. It's not a kind of thing. It's just a little lengthening, because what we're doing again is we're putting that decompression in there, but we're going to do it right at the SI joints as well as L5-S1. And by doing it, by pulling it that way, you're going to be able to access, especially when you know where to go, you'll be able to access the dural tube. And I'll also give a little bit of a stretch of the dural tube that goes all the way up to the head. So that's another thing, and that helps to relax. If you feel like there's a sort of tight, or you're told to do something else, you can slip your hand underneath. Just slip it there, put it right above your fingertips on the lumbar vertebrae. Separate the fingers out so there's the vertebrae is between the fingers. I usually just use 3 fingers, because this one doesn't quite reach sometimes, and then I'm too far. So I use 3 fingers under there along the vertebrae. It doesn't matter, just find that lumbar part, hold that with your fingers spread, and just anchor that while you're allowing a little decompression with the sacrum. So you want to stabilize that upper back, or the lumbar part of the back. You want to stabilize that, which is just above the sacrum. And now the sacrum has a lot of room. There's a lot of wiggling going on. There's a lot of little jumping. Now I heard some noise in her stomach. That's a good sign when you hear rumbling in the stomach. That's a really good sign, because it means things are opening. And and then it gets soft. Now it's getting soft again. And my bottom hand is holding into it, but I'm not pushing into it. It's that her weight is into my hand, which is more of what's happening. Okay? All right. There's a lot of therapeutic pulsing. So her hips have changed. And I'll take this out and make sure the top is soft. We're almost there. Sacrum. Now I wait for the cranial rhythm to know that it's done. And we haven't had one yet, but it's coming. See, when you do this over and over and over for a long number of years, you get to where you'll be able to hear the communication before it's happening. It's almost like it's saying, I'm getting ready to go left or right or turn or whatever. So then you can follow it. When you follow that movement, what you're actually doing is putting a little bit of resistance behind where it's moving to so that it won't slip back into the old pattern. So it wants to keep moving forward. It needs that help. The tissues need that help in order to make the change. But you don't force that because you don't know the way it needs to go, because it swims all over the place. You can't just push it in a straight line. It doesn't work that way. And the more aggressive therapies that are out there, which are necessary at times, but they don't address the small stuff. They don't address the little winding stuff. So if you're going to couple there was a big jump right there in her hip. If you're going to couple the other therapies with the subtle anatomy therapy, please understand that the subtle anatomy is like the foundation. It's the foundational work. A nylon on the leg being twisted is going to draw up the pair of pants into that twist. And until the nylon gets straightened, the pants aren't going to stay straight, if that's a good analogy for you to follow. Now, there's a lot of things. Her little sacrum is just moving all over the place. And I'm dropping my hand. Well, I feel like I'm dropping my hand deeper into the table because I'm starting to separate from her sacrum, so it's not pulling me quite as tightly to it, because it's almost finished. And then the rhythm is going to be here in a minute, in a second. There it is. There's the rhythm. And the rhythm, when it comes to the rhythm, you want to make sure that the sacrum is well balanced, which it is.
When she came up to the hip area, the sacrum, I was so not falling asleep, but I was very sleepy. I couldn't let that, stay as conscious then. So,
and then we're going to see how this works here. I'm going to pick the legs up, and I'm going to test this one more time. And oh my gosh, they lift so much easier, and they're lifting higher, and the hip joints are moving with a lot more movement. You might be able to see the difference in the movement. Now I'm going to set the legs down, find where they want to go. This is where they want to go. Even though she was very straight to start with, she looks straighter. The feet are at a good angle, even. Sometimes with that, people do need to have a little bolster under there. So it's okay to work with a little bolster. Sometimes people have to use a big bolster, and that's okay. It's a little bit more shifting around for the therapist, but wherever they're comfortable, that's where you've got to work from. You can't really demand things from the person on the table. You've got to be where they need to be and work from that point. And that's another little thing I'm going to say. There's far too many therapists that I've met that are more concerned about them doing it a certain way, the way they want to do it, instead of the way that it needs to be done for the person on the table. Okay, this is good. A lot of changes. The feet are still fluid. The feet are good and fluid. And so that is how you work into the deeper subtle anatomy structures of the joints of the lower extremities. It's something that takes some work when you're a therapist. It takes a little bit of gymnastics when you're a therapist. So
that's my experience so far. And I've seen Athena a few years ago, actually, and I had a traumatic event where 2 men had threatened to kill me, and I had already an appointment with her like 24 or 22 hours earlier is when the threat came, and I kept my appointment with her, and I had like the PTSD was starting, this redoing it, and so it left my body. It left my body, and so that's why when she talks and touches me, I really like to be present. And I also like to go with the relaxation when it's there too, because it's very deeply relaxing, I can tell you that. but I do like to tune in because I respect listening and feeling my body. But because I had that significant experience of a trauma and then coming into that, I could really feel the movement and connected it in that experience that day.
I'm going to continue to show you different things to keep you going in this direction for those of you who want. And for those of you who are just interested to watch it, please enjoy, and I'll see you next time. Thank you so much for watching. Have a great day. Thank you for sharing. Thank you for subscribing. Thank you for the thumbs up. And I think there's a little bell up there that you can hit that you'll get a notification every time we post. So if you want to, you can hit that too. But thank you so much for your support. I really appreciate it.